Hello, everybody. My name is Jeremy Shaba, and I'm a veterinary student at the Ontario Veterinary College. I'm here today with Dr. Jamie Kopper, a 2013 Michigan State graduate and a current intern at the University of Pennsylvania School of Veterinary Medicine. Welcome.
Hey, thanks, Jeremy.
So I thought we could start off and you could give a brief overview of the internship.
Yeah, so here at New Bolton Center, we have 6 interns. We're all hospital interns. It's a rotating internship. We split our time between medicine and surgery. And then within the surgery service, there's 2 elective services. There's food animal surgery, and then there's also an emergency service. So emergency critical care service is a 24-hour service here that's of its own entity. So there's no transferring cases to medicine or surgery. The day schedule for the elective services, they go on with their own thing while the colics come in. And the emergency and critical care surgeons will take care of them. And then on medicine service, we have similarly, there's the what we call high risk medicine, which is the emergency service. So they see a lot of the diarrheas, the colitises, et cetera, that come in. And then what we call low risk medicine, which are the appointment based medicine programs. And then we also have the opportunity to do elective rotations. We each get 2 of them to choose from. So I happen to choose ophthalmology and NICU. But some of the other options included ultrasound and cardio, sports medicine, field service, any of the other departments or services that the hospital has.
So did you say, do you rotate through the food animal department too, or just equine?
So we do food animal as well. We all get a month on food animal surgery, which is lovely. I had a really good time on that rotation. And then on the medicine service, they'll see non-surgical food animal cases as well that we all see and are a part of.
Cool. And how would you describe the mentorship that you've experienced so far?
It's excellent. I have to say we each get assigned a mentor / we get to choose a mentor.
Mm-hmm.
And I can't actually say enough good things about my mentor. She's been incredibly instrumental in me becoming the doctor that I'm becoming and the career paths that I've chosen. So I think, and honestly, all of the doctors and the clinicians they take an interest in us and take time to help us find our way through the years. So I've really been pleased.
Yeah. And for students out there who are unsure if they should do an academic or a private practice internship, one of the qualms I've had is, if I'm going to do it at a university, I feel like I'm going to be competing with vet students and residents, and that hands-on experience is going to be limited. What do you have to say to someone who says that?
I think the first question you have to ask yourself when you decide if you want to do an academic internship is if you're at all interested in teaching, because it's a huge part of our day, and some people that's not what they want to spend part of their internship doing. And that's a perfectly fine answer, but it's just something you have to be honest with yourself about. And I, too, coming from Michigan State, we didn't have large animal interns, so I wasn't really sure where they would fit into the mix. There were residents, there were students, and I didn't understand how an intern would fit in. But I can't speak for the other academic institutions, but at least at Penn, with the caseload that we have, I don't ever really feel like I'm fighting for the opportunity to do things with residents or students. Sometimes we're on with residents for the day schedule, but there's enough cases going on that, they're in one surgery, we're in another surgery. There's not a lot of competition there. And then with the students, now we're getting to the point where our 4th years are getting ready to graduate. And so we're, helping them learn to do more hands-on skills. But I haven't honestly felt in competition with them. And it may just be because we have the caseload to support that here. It's a little bit hard to say, but it's been lovely.
Yeah. And for students out there who are still unsure if they want to do an internship, what advice do you have for them?
I think a big question you have to ask yourself is what you want to do with your life. There are some career paths that simply require doing an internship. I honestly didn't plan on doing an internship at all. I wasn't even going to be an equine doctor until I hit clinics, and so I came into it a little bit late. Partly if you want to do a residency, it's just part of your path, and so that takes care of that question for you. But there are also a lot of people that don't want to do residencies, and it's any other year of hands-on training, a year to give you a safety net to fall back to, which some private practices offer, but not all of them. So I think it's a little bit of what you're comfortable with and what you think that you need to be the best doctor you can be.
Great. Thank you, Dr. Kopper. If you guys would like to see some more interviews or have any questions for me or Dr. Kopper, you can check out my blog at jeremyshaba.com, and we'll talk to you later.